The following show is sponsored by Sacred Circle Healthcare. Welcome to the show, everyone. I'm Brooke Mangum.
And I'm Caitlin Hansen, and we've taken the show on the road today. We are downtown Salt Lake City at Sacred Circle Healthcare.
We're going to be learning all about this clinic and the many services they provide here, from podiatry to dental.
I mean, really mouth to toe.
Yeah.
And they service so many people in the community, so I say we check it out.
Let's do it. Here we go. After you, milady.
Well, I thank you.
I'm here with Lorena, the Executive Director of Sacred Circle Healthcare, and I'm here with Rupert, who's the Chairman of the tribe. Now, Lorena, we just barely walked through the doors of Sacred Circle Healthcare. Tell us what you guys do and what services you provide.
Yeah, so we are a tribally owned clinic. We're located downtown, and we provide services to patients who have Medicaid or Medicare. And our patients here really enjoy coming here because we provide services across the board. We have family care providers, behavioral health, lab, pharmacy. We're kind of a one-stop shop.
A little something for everyone. Now, you mentioned that it was tribally owned, and Rupert, you're actually the chairman of the tribe, so tell us a little bit about your tribe and how Sacred Circle is connected to you.
The Confederate Tribe of the Goshen is located about 65 miles south of Windover. We're a small tribe. We have 560 members, and this clinic is the arm of the Confederate Tribes of the Goshen under what they call a Indian Self-Determination and Education Act, otherwise known as Public Law 93-638 contract, which the tribe can do with the federal government, and this is a result of one of those contracts.
And what a result it is. So can anybody come and be a patient here, or do you have to be a member of the tribe?
Absolutely not. So we provide services to all Native Americans, but of course, if you have Medicaid, Medicare, come on down.
Welcome to anybody. Where can people go for more information?
You can call our phone and make an appointment, or you can go to our website.
Okay, sacredcirclehealth.com. I just memorized it right here. Now we are going to go check in with Caitlin, who is meeting with some doctors right now.
Thanks, Brooke. And you're right, we are meeting with the doctors now to tell us all the facts right here. I'm here with Dr. Lindsay Roper and Dr. Leon Butler, and we are talking about chronic pain. That goes hand in hand with the opioid epidemic that is sweeping the globe, really. And so let's address that first before we talk about the treatments here.
Yeah, so chronic pain is really a global problem, but here in the U.S., a quarter of the population suffers from chronic pain. So it is a big deal. And the opioid crisis is rising, and right now the newest statistic is that 115 people die each day from an opioid overdose. Wow. So big deal, right? So there's a lot of research going into chronic pain right now, and that's kind of where we're headed in our treatment program.
So those are staggering numbers, and the opioid epidemic and this addiction problem comes from a very innocent place, isn't that right? Because the medication can help to some degree.
It can help. We just know now through research in what chronic pain actually is that it doesn't help just by itself to the best of its ability, right? Like, we need these other treatment approaches because chronic pain is so complex.
And what is the complexity? Can we break it down and simplify it? What is chronic pain defined as exactly?
Yeah, so chronic pain and acute pain are actually both made by the nervous system, right? So pain comes from your nervous system. But chronic pain is a little bit different because the nervous system is comprised of these 45 miles of nerves within your body, but then it comes up and connects to this awesome brain that we have. And so chronic pain is actually just a hypersensitivity of the system. And what's happening all throughout the day is your body is sampling information from your body and your mind and your environment, and it's gathering information and deciding if it should produce a threat because it's under stress, right? So this is what chronic pain is. So we have this hypersensitive nervous system, and it needs to be treated just a little bit different.
And there are so many ways that you can treat it. You don't have to be worried that you're going to live with this your entire life. And you can come down here to Sacred Circle. There are ways to treat this and to be pain-free, really, right?
For sure. So because we know that chronic pain is a multifaceted thing and that it's real, people experience this. And again, this opiate epidemic is coming from typically a very innocent place. People get their medications and they think this is going to help me and it's what I need. However, here at our clinic, what we're doing is recognizing the utility of that medication and then also expanding the treatment, right? So we include things like physical therapy, as well as behavioral health treatment, both groups and individual as needed, that's going to help the people to address their pain not just from a biology, right, but from also the psychology and the social aspects that are also important.
And that's a big deal because I'm sure there are people watching right now thinking, I've been to physical therapy, I've done these things, I'm still in pain, but you have this new approach.
For sure, yeah. So we get this all the time, right? People are always saying, I've done this. I've already done physical therapy, and it hurts, right? But it's different here, right? So what we're doing is we have this multidisciplinary team of professionals who are going to care about you, right? We want to know your pain. We want to know what your experience is like. And then we're going to help you as we collaborate together, both your medical, your physical therapist, and your psychologist, right? To help you with your pain experience and to reduce that pain and increase your life functioning.
And make sure that you're not one of the statistics that is addicted to this medication, right?
Exactly. So again, the approach helps to decrease the need and sometimes eliminate the need of that medication, because when we address all of these different areas, again, kind of a biopsychosocial aspect to the pain, then we are really seeing a reduction in the need of medication.
If someone's watching this right now and thinking, I've been in pain, I've had no solution this far, what do you have to say to them about this process and about reaching out to you guys?
For sure. I would say try it. Right? Come on out and give it a try. What we find again is people coming in, we're running these groups that are really good, these physical therapy sessions, and people will start out with kind of a little standoffish attitude, right? I'm not sure that I want this, but inevitably by the end we have success. We have amazing results right now. People are reporting that the groups are helpful. We're doing sleep stuff.
There's hope for you, absolutely. So come on down, contact Sacred Circle and get the help you need to have a pain-free future. We're going to continue to find out all the services that they have to offer here. That's coming up.